Hi everybody, this is Jackie Elder, one of your instructors for the Intro to Online Motivational Interviewing course, which is the first course of 3 for our certificate program. Um, you should have just, hopefully, watched the little 5-minute segment of the famous Bob Newhart Stop It video. One of the reasons, well, other than it's ridiculously funny, is that on some levels it's every practitioner or helper's fantasy to just be able to say, just stop it. One of the skills in MI that um, is that you can think whatever you want, but just don't say it. In the video you just saw, Bob just let loose and said absolutely everything he was thinking. And if I, as a helper, practitioner, if you were to do that, you probably would have no clients and no patients at all. Um, so motivational interviewing, the most recent definition, I'm going to have to read it to you because they've been working on it, it's changing. So motivational interviewing is a client-centered, so it does have its basis in client-centered Rogerian counseling theory, and a lot of that has to do with the fact that we are meeting the client where they are at. We're not forcing our agenda on them. We're entering their world. They have hopefully invited us in for this journey, and we go in and we're there to enjoy the ride and sit next to them and hear what they have to say. And ask them about this thing, that this behavior change that brings them into our offices. Everybody comes to see us for some particular reason. Many of the people that I see are being forced to come in. They're being mandated by the courts. They're being mandated by DCFS. They're being mandated by their physician. They're being mandated by their partner. Even if it's not an official mandate, if somebody is making somebody come in, uh, I consider that a mandate. It's very and then on occasion, we get the nice luxury of the actual self referral of someone coming in and saying, I really am here because I want to quit smoking. I'm really here because I've decided to stop shooting up IV. I'm really here because I'm ready to do everything to be compliant with my diabetes management. Those are lovely. Yet, I don't know that they do any better than the folks that are forced to come in, to be quite honest with you. Um, so it does have its foundations in meeting the client where they're at, with a great deal of respect and collaboration, and the art of reflective listening. Um, there's a general formula of the client or patient speaking 70% of the time and the helper talking only 30% of the time, and then a gold standard would be 80% patient and 20% client. So let me go back. So MI is a client-centered, just went through that, directive method for enhancing intrinsic motivation. So it's assuming that everybody wants their life to be somewhat better, but they get to define what better is for them. And it's not always what we think it is, it's what they think it is. And as a result, motivational interviewing is a harm reduction model. So we're enhancing intrinsic motivation to change by exploring and resolving ambivalence. We're not always able to resolve ambivalence and we wouldn't push on it if someone decided to. If they made a decision not to make a decision, that's a decision, and we respect that. We respect people's choices in even deciding upon a lifestyle that is going to lead to probable death, because we really can't do anything about it for the most point, but we do our gosh darn best to try and deter them, mostly through forming relationships and letting them know somehow that there's at least one person who cares about them. So, what sets MI apart from other counseling session theories or techniques is really its use of direction, which is behavior therapy. A lot of people don't notice the very strategic behavior therapy that is going on in an MI session. The key, as it turns out, is not so much what we originally thought were the micro skills of ORS, which is open ended questions, affirmations, reflections, and summaries. It is turning out to be being able to identify the client's change talk that they're giving to us and doing something with it strategically. And that is what helps move towards exploring and potentially resolving ambivalence about it their way. And sometimes we may not think their way is the best way, but surprisingly enough, they often have wonderful ideas that we think aren't going to work. And guess what? They work in spite of us. So, identifying change talk is very important, but we are going to be working in this module on some examples of what makes for a good motivational interviewing session, a not so good motivational interviewing session, and even a middle of the road one, because this is a very simplistic looking technique that is actually a bit more difficult than it looks like. But once you get an idea of what to do, and that's part of what we'll be doing in this course, and a lot of it will be through your willingness to share your work with us in your audio tape. So first of all, I want to thank you so much for that's very vulnerable. It takes a lot of courage, and we're going to code them, give you feedback. So I'm going to stop there, but that's really what makes it very different is the directiveness of it. Now, that doesn't mean it's confrontational in any way. The therapist is being very strategic as to what they're reinforcing in terms of language from the client, and they're shaping. They're, in behavioral terms, they're shaping and moving. It's as if there is a compass that is present in the session moving towards what we call the target behavior. And the metaphor that is used, this was developed by a mentee, Jeff Allison, is that they're dancing. We are dancing with our clients versus then wrestling with them. And the whole time, very strategically, moving towards the target behavior. It may sound, sometimes people think it's manipulative, yet it's not. We would never, ever, you can't make people do anything that they don't want to do, ever. And that is human nature. So in this particular module, we're going to be exploring some of the things about why people change, what these sessions look like, and begin to work on some of the micro skills and incorporating the beginnings of introduction of change talk. Okay, thanks. Hey, I put makeup on for you guys. I just want to know you're very special to me. So, all right.